From KCBS Radio, I'm Matt Pitman, and this is Bay Current for Thursday, February 10th. If you're anything like me, the news from Tuesday was music to your ears. For a few seconds before you started thinking, but is it really the best idea? Of course, we're talking about rolling back mask mandates. All Bay Area counties except for Santa Clara County announcing on Tuesday that they're lifting mask mandates for vaccinated people beginning February 16th. But is it actually, finally, the right time to safely do so? No one knows more about this issue, no one, than Dr. Monica Gandhi at UCSF. She has advised local and federal health departments on mask regulations, and she's been an invaluable resource for us here at KCBS, as well as the Bay Area, having one of the nation's preeminent infectious disease doctors right here in our own backyard. Dr. Gandhi is my guest today. And I guess, Dr. Gandhi, my first question would be, is now the right time?
You know, it is the right time, in my opinion, in the Bay Area because of our high vaccination and our manageable hospitalization rates. So I think that it is the right time, as we've come off the Omicron surge, to do so next week.
Well, the larger question then becomes, I guess, the rest of the country, right? Between, yes. Man, you can pick certain pockets of the country which are still having high hospitalization and new infection rates, and are states, frankly, that don't have mask mandates in place right now. Other places, New York, Illinois, here in California, strict mask mandates, encouraging and positive numbers in terms of the hospitalizations and new infections. So what is, I guess, the fine line, the balancing act of when it becomes appropriate for states nationwide to take this approach of easing mask mandates? Right.
So I've always said, or for quite a long time now, actually almost a year from April 2021, when I wrote a piece with Ashish Jha and Sarah Madad in the Washington Post, that the two parameters we should go to look for lifting of restrictions, and of course masks are our last restriction, is a vaccination and a hospitalization rate. And the reason that I wouldn't go on transmission rates as defined by the CDC is because cases before we had vaccines meant a lot. A case meant that someone could get very sick. Now that we have vaccines, cases and hospitalizations delink or decouple from each other in highly vaccinated places. And beyond that, as you know, our cases are in a way all over the place because some places test more and some places test less. So I think the cleanest way to do this for the entire country with federal guidance, which I hope will come, is using a vaccination and a hospitalization rate. I would use a 70% vaccination rate in that region. And on the hospitalization rate, confirm that you have continued ICU capacity, because that is the most important place. Why did we lock down? Why did we use masks? We did it to flatten the curve. We need to ensure that our hospitals have good capacity. So at least having at least 15% ICU capacity, for example, and only 20% of the people in the ICU being there for COVID, some sort of metric like that, so that we know we have a hospitalization and vaccination rate that's safe to lift our restrictions like we're doing here in California.
And here in California, ballpark, what do those numbers look like by your own metric? And I guess, is it time now to effectively and appropriately and safely start to look at statewide saying, hey, masks can finally come off?
Yes. So I did do that calculation actually on Monday for my own kind of research, looking at there's a particular tool that's really important. It's an HHS tool that tells us hospitalizations and ICU capacity for all hospitals in your region. So when I looked at that, I could see that, for example, Mississippi does not have 15% capacity left. They are more than 85% full in their ICUs. I would not lift it in Mississippi. And Tennessee, same thing. But I looked at all 5 of the states that where the governors had announced lifting of mask mandates, which were New Jersey, New York, California, Oregon, and Connecticut, and Delaware actually, so 6. And they all fit within these parameters of 70% vaccination rate and having plenty of capacity in their ICU and not having 20% of the ICU capacity being taken up by COVID patients. So when I did those calculations, and if the White House adopts this, then what happened on Monday with all these governors would be completely in line with federal guidance if they decide.
Very interesting. Would you apply that to school children as well, saying that if a mask mandate is lifted in a city or county, that not only applies to restaurants or concerts or church services, but that can also apply to schools?
Well, I would, only because children are less at risk for severe disease than adults. On the other hand, and I think this is an important caveat, Oregon said it's going to be the same day for schools and for the general population. New Jersey said the same thing. As you know, California said just for the general population, but not for schools. One idea for schools is that it is really, we want to ensure that our hospitalizations and our burden of disease is low. And so to wait a little bit, like say wait a month, ensure that we're still absolutely in the right direction, and then lift them in schools. And the reason I'd say that is there is a little bit of a difference in schools that our vaccination rate is not as high as we would have liked in the United States in general among 5 to 11-year-olds. So it's really just ensuring the burden of disease stays low in the community before lifting it, masks in schools.
Last question for you. Last time we chatted here on the podcast was when Omicron was emerging, and we were just starting to learn about the nature of it in terms of being so much more infectious and transmissible, but not as virulent. Looking back from, say, mid-December when Omicron really started to kind of take over for a little bit versus now, did we dodge a bullet with that one, in the fact that we had vaccines in place and that people knew what interventions and what precautions to take? And how do you look at Omicron now versus even 2 months ago?
Yeah, it's a great question, because I happen to have been working in the hospital for the last 4 weeks. And so I really feel like I have a firsthand perception of the variant in a highly vaccinated region like the Bay Area. It is just simply true that our vaccination saved us. We had people who were in the ICU or very ill, unfortunately, were people who were unvaccinated adults. And then there were a lot more admissions, but some of them were because we just swab everyone's nose, this so-called with COVID versus for COVID. And that's why our hospitalizations actually for COVID remained very controlled, because we had vaccinations. And then third is that hospital staffing is always harder in the winter, especially right now, because we needed to stay home if any of the hospital staff were exposed to COVID. So that reduced our hospital staffing numbers, but it didn't mean that we were flooded. And so the important part is what we just talked about before in KCBS. We saw it really did come true that in places of high immunity, they could weather it. And perhaps it is less virulent inherently, but I'd still want people to be vaccinated. And I just can't stress that enough.
Right. Always useful information from you, and I do appreciate you taking a few minutes of your time. Know how busy you are, so thank you so much, and hopefully when we chat in a few more months, we have even better news to talk about.
Yes, so I hope so too.
It's a trend we'd like to start. Thank you.
Yes, thank you.
For more information, especially the specifics on where mask mandates are being rolled back, where they're not and why, and what specifically you'll be able to do without a mask and where, we've got all that covered at kcbsradio.com. Thanks again to Dr. Gandhi for joining me today, and thank you for listening. New episodes of Bay Current are out every day, and we would love to be part of your daily routine. So subscribe to the Bay Current podcast on the Odyssey app, Apple Podcasts, Google Podcasts, or just about anywhere you listen. And we're also on YouTube on the KCBS Radio YouTube page. That's it for today's Bay Current. I'm Matt Pitman. We'll chat with you again tomorrow.